or lack of blood flow and oxygen to the tissues, and the tissue dies.
And wouldn't the child die too?
Exactly. The child dies too, unfortunately. So it's a very tragic situation.
And so, Dr. Lee, you see women every day in your practice. How many women do you see that have some of these same issues?
Same issues such as the fistulas?
The fallen bladder and issues like
that.
Actually,
quite a few women, and most of them actually kind of come to me saying, I feel a bulge down there, and can you take a look and see if it's my bladder or it's my rectum falling out? And so typically I'll say, yeah, that's your bladder, and it's just very mild, or it's more significant. And if the bladder is dropped a lot, women will have a lot of frequent urination. They can't empty the bladder completely, so they have to go more often, and sometimes that can lead to more bladder infections as well.
Okay, so it's not always a result of hysterectomy. They're having these issues whether they have all their organs or not.
Right. I think a lot of the prolapse can be genetic too. I've even seen a nun in the beginning of my practice. She never had a baby, never had a childbirth, and her whole organ was fallen out.
Really?
Yes.
And so this is a fixable condition. We talked about that. Does it always require surgery, or are there other things you can do?
Oh, very good question. Not always surgery. For a lot of women that are not sexually active anymore, sometimes we'll do what's called a pessary. And these objects come in the shape of either a donut or a ring, different sizes, so we can fit them with this pessary. And then some women can take it out on their own and wash it and put it back in. But sometimes it can be quite difficult to do it on their own. So then I end up seeing them in the office every 2 to 4 months, so I can do that for them.
Okay, so what kind of symptoms would a woman have, other than bladder leakage, if they have fallen organs?
It's more feeling the bulge, uncomfortable sensation, and when you're wiping, you feel something down there, so.
And what about, wouldn't it be painful intercourse? And
usually with the fallen organ, there's no pain during intercourse. It's more the bulge, that mass sitting that shouldn't be there when you're walking and sitting.
Wow, that would be so uncomfortable. Yeah. So let's just throw this out to whichever one of you want to answer, but how many women have fallen organs because of a hysterectomy that they had years ago that was not, maybe had mesh put in or wasn't taken care of the right way? What percentage of the women would have problems down the road?
If I may, once you have a pelvic surgery, be it a hysterectomy, whatever, you have a 20 to 30% chance of needing another reconstructive surgery for something falling. So it's a fairly high number. As you mentioned, 1 in 3 will have hysterectomy, and upwards of a third of those ladies are going to need something else done. So it's a fairly significant number.
So why wouldn't the surgeon just do it at the same time?
The reconstruction?
Yes.
It's often, it's a good point, and it is often done at the same time. It depends on what problems you perceive that she's having at the time. And the difficult thing is what do you fix and what do you leave? You look at it and you try to fix only the things that appear to be broken. You don't want to be guilty of doing every surgery on everybody, because not everybody needs every surgery. If you do enough of them, you'll end up with complications, God forbid. So you try to tailor the surgery to the patient's needs. The problem is that even if things look healthy and attached, once you fix one organ, because everything interplays with the other side can break down. For instance, if you do a midline bladder repair, which is a standard repair where you just pull the sides across the middle to get the sag out of the bladder.
Okay.
When these recur, they tend to recur because there's extra pressure where the bladder attaches to the side of the pelvis. So it's not that the original repair broke, but the original repair took away the weak spot. The pressure had to find the next weak spot, which is what you didn't fix.
Kind of like a domino effect.
Exactly.
Okay. We need to take another break. We'll be right back with our last segment of Make Your Life Healthy. Don't go away. We'll be back with Dr. Julia Lee and Dr. Greg Owens. Welcome back to Make Your Life Healthy. We're in our final segment of our program today with Dr. Julia Lee and Dr. Greg Owens, husband and wife, from this wonderful program and topic we've had today. In our last segment, we're really going to talk about, in general, things that are going on in women's health issues. We see a lot of commercials for vaccines and STDs and all that kind of stuff. How has your practice changed over the last 10 years?
To be honest with you, Pat, I don't think it has changed much at all.
Really?
Yeah, I think it's still the same problems over and over. I see a lot of women complaining of either no sexual desire or decreased sexual desire.
And is that because of aging, the aging population?
It's more common in older women than younger women, but sometimes I'll see it in women in their 20s.
Well, what do you think about hormone replacement?
The latest thing with hormone replacement therapy is if somebody has significant hot flashes that's really interfering with life, then by all means go ahead.
Okay.
But if it's tolerable, it's better not to start hormone therapy.
But they talk about hormone replacement on television. They've got this hormone honeymoon cottage. I mean, they've all kinds of things. And it sounds like they give hormones for everything. Men and women are taking it. It's supposed to increase their sexual drive. It's supposed to help them sleep. I mean, it sounds like it's a magic pill for everything.
And of course, there's no such thing. No magic that's perfect without side effects. The testosterone is the hormone that can increase a sexual desire, but it comes with a lot of side effects
too. In a woman, they would give testosterone?
Yes, in women too. Yeah.
Okay. And so, like, a lot of women, like you were talking about, goes through the change, and they get estrogen, I guess, to stop the hot flashes.
Right.
And so, do they stay on that forever, just while they're going through menopause?
Usually, we try to do that for maybe 5 years or so, but every time you try to lower the dosage or taper the women off, the hot flashes can come back.
Okay.
So we have to do it very slowly, and that's why, we try not to even start if symptoms are tolerable.
Okay. And so then if they go and get synthetic hormones and they're getting testosterone to increase their sexual drive, what side effects are they going to have?
The most common side effects could be more facial hair, acne, and then some women could even notice deepening of their voice, more aggressiveness to their personality.
Over what period of time does that happen?
That can happen within 6 months.
Really?
Yeah.
And so it really isn't a wonderful thing to do. I mean,
right. I mean, that has to be followed very closely with blood levels to make sure the levels aren't getting too high. You want a level that's high enough to give the woman some benefits, but not too high where she's getting so much side effects.
unbelievable. Yeah. And I know that, what does it do for a man? I mean, is it going to help with ED if they have erectile dysfunction, or why are they taking the hormones?
I think testosterone in general can give somebody more energy.
Okay.
In addition to help with the ED issues.
And it helps them sleep better and have a great outlook on life. They're no longer depressed. I mean, that's what it sounds like.
Yeah, I think it can really help in all that ways as long as the levels don't get too high.
Okay, so because I really am an advocate for natural everything.
Sure.
What can you do in your eating and drinking and exercise program that's going to help with these same issues?
Generally, obviously, not overeating, small frequent meals, regular exercises. That's going to help, with the sleep, and also with and going out on dates with your partner.
Okay.
That'll bring back that romance back to your life, and so those natural things are, things that we need to all work on doing.
Yeah, those would be important things, I think,
right,
as well.
Right.
And so, when you're talking to a woman who has these issues, other than maybe not a physical issue, which it kind of is, I guess, but hormone imbalance, do you start off by giving them hormones, or do you start off by saying, let's take these gradual things? I mean, what's your process?
I think I asked them, how big of a problem is it, and if they even have, unfortunately nowadays everybody's busy. People are work, they have kids, other stuff they've got to do, so some people really just don't have time to really take time and do the proper exercise and go out on a date or different things like that. So oftentimes I will offer hormone therapy because I don't think hormones are bad. I think it can definitely make a big difference. So when it's needed, it's definitely beneficial, and we just want to taper off the dosage or make sure it's the right dosage, and to make sure there are no side effects such as, there's increased risk of blood clots from the hormones that we need to keep in mind.
So there's other issues that they could be facing as well.
Right.
So in general, when a woman, because we talked about 1 in 3 women need a hysterectomy by the time they're 60, 1 in 4 women have bladder issues, bladder leakage. I mean, there's a lot of issues that in women's health that really aren't talked about a lot until there's an issue like with the pelvic mesh and this, the lawsuits and things that are against it. But is it just the natural aging process, and the baby boomers are getting older, so we're seeing more and more of these things coming about, and that's just how it is? I mean, we just have to deal with it?
Well, I think one thing that we do see more is that's a natural aging process is the thinning of the vagina once the woman's period stops because estrogen level drops. So I see a lot of women that have painful intercourse.
Really?
Or sometimes it's so bad that they can't even have sex anymore. And that's when estrogen works wonders.
Okay.
It really helps with the elasticity, the suppleness of the vagina. And we can do low doses that we just insert in the vagina
Really?
where it has very little side effects, if any. So I love using vaginal estrogen for sexual function.
And so then you just put it in one time and then...
Usually it's twice a week. And there's tablets you can do, so it's not as messy as a cream, but there's always been cream that you insert twice a week. And for a lot of women that said, I'm very forgetful, I can't remember to do it, then there's a ring that you can put in for 3 months at a time.
No kidding.
Yeah, so there are a lot of options out there.
And that is a hormone too. They're getting hormone back into their bodies. Well, this has been such an interesting program. I love seeing the robotic surgery. Thank you so much for allowing us into the operating room with you. And of course, the patient who agreed to let us do that, we did have permission from the patient. And thank you for coming on and talking about women's issues. There are so many things that affect women, and it just seems like we only hear about breast cancer. I mean, not that I'm minimizing it at all, because 1 in 8 women I know get breast cancer, but 1 in 4 women have bladder leakage, and 1 in 3 women need a hysterectomy. So these are things also that need to be talked about. And we really appreciate your time on the program today and coming out and bringing your tools and your mesh and just the things that you talked about. And I hope all of you enjoyed our program as well. Please continue to watch us. We have great programs coming up this fall in our fall lineup. And we thank Dr. Greg Owens. And you have a website, if you want to give your website.
It's www.advancedpelvic.com.
All right, and Dr. Lee, do you have a website?
Yes, we do. I believe it's CINCYOBGYN.com. CincyOBGYN.
So if you want more information on either one of it, and we will have those on the crawler across our program as well, so the people will be able to see it. Thank you so much for joining us today on Make Your Life Healthy, and we will see you again next week.